Okay, so good morning once again, and welcome to your lesson for the third or fourth week rather. We will be discussing micronutrients starting with vitamins. Okay, before anything else, am I still audible? Okay ba yung sound quality ko? Okay.
Yes po, ma'am.
Okay, thank you. Okay, so vitamins are potent, essential, non-caloric, organic nutrients needed from food in trace amounts to perform specific functions that promote growth, reproduction, and maintenance of health and life. Okay, so we have here these three distinguishing characteristics of vitamins. So they do not yield energy when broken down, but they assist the enzymes that release energy from carbohydrates, proteins, and fats. Okay, and they are needed in much smaller amounts than the energy nutrients. That's why they are called micronutrients. Okay, and they are dietary essentials. Okay, so mga common na uh, dietary essentials or supplements rather. Okay, so we have a lot of them actually. May mga supplements for vitamin E, vitamin D, vitamin C, and so on and so forth. Okay, and by the way, our vitamins are also categorized according to their chemical composition. So we have fat-soluble and water-soluble vitamins. Okay, so you will see the other differences in the next few slides as we go on. Okay, so next, okay, so this is the part na may mga notes. Okay, I'm just going to adjust this para makita ninyo. Okay, so factors affecting bioavailability of vitamins. Okay, so keyword. Okay, so when we say bioavailability, it means or it refers to the rate and extent to which a nutrient is absorbed and used. Okay, so this is more on the biochem side. Okay, so factors affecting the bioavailability of vitamins are the following. Okay, so the quantity provided by food. Next, the amount absorbed and used by the body. A person's previous nutrient intake and nutritional status. Okay, so kung ano yung nakain niya plus yung nutritional state niya. Okay, because there are some people who eat uh, who the no two people are the same when it comes to eating habits or the ability to take in a certain amount of food. Okay, and meron din namang mga tao or patients who do not easily absorb certain nutrients. Okay, next we have other foods eaten at the same time. The method of food preparation. So methods of food preparation are it's either raw or cooked, for example. Okay, and the source of nutrients. So when we say the source of nutrients, this refers to those that are either naturally occurring, synthetic, or fortified. Okay, so just a few notes for this slide. Okay. Okay, next. Okay, so we proceed with the terms. So terms associated with our discussion on vitamins. So we have precursor or provitamin. So these are compounds that can be changed to the active vitamins. Okay, and they are potential vitamins. Okay, so para sila yung key para magamit yung main na vitamin. Okay, so for example, we have carotene is to vitamin A, in the S1 ergosterol is to vitamin D. Okay, so sila yung key para magamit yung active na vitamin. Okay? Next, we have preformed vitamins. So these are naturally occurring that in active form and ready for its biological role. Okay, so as you can see here, my note dito, some of the vitamins are available from foods in inactive forms known as precursors or provitamins. Okay, so once that these are inside the body, the precursor is converted to the active form of vitamin. Thus, in measuring a person's vitamin intake, it is important to count both the actual the amount of the actual vitamin and the potential amount available from its precursors. Okay, so on the nursing side, on the nursing side, just understand the simple definition. Okay, what is precursor, what is preform. Okay, huwag masyado magpa-bother sa mga biochemical descriptions for your for your nutrients. Okay, again, we are more on the nursing management and and knowing the different types of foods that offer certain nutrients. Okay, so wag magpa-stress sa mga hindi under sa scope natin for our practice. Okay? So next, we have vitaminosis. Okay, so this is a condition resulting from a lack of vitamin in its later stage when more defined signs and symptoms will occur. Okay, so for example here, serophthalmia, okay, which is a vitamin A deficiency. Okay, so um, certain certain disorders with regards to lacking vitamins will have major effects on our body function. So here in serophthalmia, definitely my visual disturbance. Okay, and if left untreated, this could lead to blindness. Okay. Next, we also have hypervitaminosis. So this is a vitamin toxicity or a condition is a result of excessive accumulation of a vitamin in the body. Okay, so let's say, for example, again, if you have an oversupply or if your body is overly exposed to vitamin A, then it would give a teratogenic effect. Okay, so when we say teratogenic, it is very destructive to cells. Okay, nakakasira siya ng cells. Okay, and especially pag pregnant ang patient and the the expectant mother is taking increased amounts of vitamin A, uh, mas at risk siya of giving damage to the baby inside. Okay, so that's what your teratogenic means. Okay, so next we proceed to the next slide. Next, you have antivitamins or vitamin antagonists. Okay, so when we say antagonist, no, yung literal meaning nito is kalaban or yung villain niya. Okay, so these are substances that interfere with the normal functioning of vitamins. So your example here is dicumarole against vitamin K. Okay, I'm not so sure if I pronounce this one correctly. Okay, so next we have synthetic vitamins. So these are man-made or synthesized in the laboratory. Okay? However, they do not substitute for normal intakes of vitamins from foods. Okay? Next, you have your vitamins. Okay, so kuya yung mga terms no under vitamins. Okay, so when we say vitamins, they are multiple forms of a vitamin. Okay, so let's say for example, yung vitamin B6, it has other forms. Okay, so we have pyridoxine, yung pinaka-common. Next, we also have pyridoxal and pyridoxamine. Okay, so just to give you an idea. Okay, okay, so next slide. Okay, so this was what I mentioned before. You have these classifications or categories of your vitamins. So we have the fat soluble and water soluble. So under fat soluble, you have ADEC or vitamin A, D, E, and K. Okay. So from the description itself, they only get dissolved or they get absorbed within fats. Okay, and then next, and they stay longer in the body. Basic understanding nito. Next, you have your water-soluble vitamins. So we only have ascorbic acid or your vitamin C and vitamin B complex. Okay, so what you need to understand about water-soluble vitamins is that yung maalala ko from years ago back when I had my nutrition, our body is amazing. Okay, so when it comes to water-soluble vitamins, pag nafe-feel or nasisense ng ating bodies na we have an oversupply of vitamin C and vitamin B, i-excrete lang ng ating bodies yung excess na vitamin B and vitamin C. Okay? So, again, okay, so additional information as you can see here sa notes. Okay, so just take note of the extra notes here kasi wala ito sa slide sa Quipper. Okay, for you to understand better. Okay, so your fat-soluble vitamins usually occur together in fats and oils, and the body absorbs them also in the way that it absorbs lipids. Okay, so understandably, if there are any conditions or disorders wherein the absorption of fat is affected, meaning the patient will also experience issues or problems when it comes to his or her fat-soluble vitamin intake. Okay, so that is why pag may patient who is suffering from conditions wherein affected yung kanyang fat absorption, the patient would often need supplementation of vitamins A, D, E, and K. Okay, so next, uh, once absorbed, fat-soluble vitamins are stored in the liver and fatty tissues until the body needs them. Okay, so again, mas matagal yung life or storage span ng fat-soluble vitamins in the body compared to water-soluble. Okay, so they are not readily excreted, and unlike most of the water-soluble vitamins, they can build up to toxic concentration. So so the catch here is that yung pinaka-main disadvantage ng ating fat-soluble vitamins is they can lead to toxic concentrations. Okay, so just remember the key details um, that I'm telling you. Okay? Okay, so here you have a table. Okay, not exactly a table, but you can see the main differences between fat-soluble vitamins and fat-soluble vitamins. Okay, so, yan. Okay, so you can go over this, okay, when you go back to your slides. Okay, kasi I have to continue with discussion on minerals. Kasi hanggang 9 kasi ako, okay, because to allow 2E to go to the clinic. But anyway, since naka-record ito, okay, anyway, ma-post ko siya. Okay, so you can always go back to this one. Okay? Just be familiarized. Familiarize yourselves with the differences between the two. Okay? So, next. Ayan. Okay, so major functions. Okay, let's start with vitamin A. Okay, so we have number 1, role in gene expression. Okay, so vitamin A exerts considerable influence on an array of bodily functions through its interactions with genes. Okay, so when it comes to genes, they direct the synthesis of proteins and enzymes to perform the metabolic work of tissues. Hence, factors that influence gene expression also affect metabolic activities. Okay, so that's just to give you a better description as to its role in gene expression. Okay, so definitely for vitamin A, it has a role in eye health or in vision. It also has a role in protein synthesis and cell differentiation. Wala, unstable. Okay. Next, okay, it also has a role in immunity, role in reproduction, and its role as an antioxidant. Okay? So, yung pinaka-important, okay, so when it comes to immunity, okay, it has a reputation of being an anti-infective because of many of the body's defenses against infection. Okay, so yung pinaka-major na trait that we associate with vitamin A is in its role in vision. But then meron din siyang other roles when it comes to uh, fighting infection as well and in gene expression. Okay? So for deficiency symptoms, we have night blindness, xerophthalmia, a poor growth, and dry skin. Next, we also have the following food sources. So it's not just carrots, okay? So there are actually a lot of other food sources for our vitamin A. Okay, so we have liver, butter, fortified milk, and margarine. And then, as for the other vegetables, we have green broccoli, sweet potato. Well, amazing na. Di vitamin A ang kamote, no? Okay, so we also have spinach, papaya, and apricots. Okay, so, yung okay, papayas and apricots, yung mga orange na fruits. Okay. Now, for toxicity, so fetal malformation, ito yung teratogenic effect niya. Okay, so excess of vitamin A will also lead to hair loss, skin changes, and pain in bones if beyond 3,000 RE per day. Okay, so ganun katindi yung mga toxicity symptoms ni vitamin A. Okay, so next slide, we have vitamin D. Okay, so our vitamin D facilitates absorption of calcium and phosphorus. Okay, so they maintain optimal calcification of bones. So again, when we say calcification, it is the process of the hardening of bones. Now, with the absence or with the lack of vitamin D, the opposite will happen. Okay? So, doon magsa-start yung softening or weakening of the bones. Okay? So, disorders associated with this are rickets and osteomalacia rather. Okay? So, the main difference between the two, okay? So, Um, okay, so description-wise, it is the softening of bones. However, in rickets is for children. Okay, yung softening of bones in children, while your osteomalacia is the softening of bones in adults. Okay, yan yung main difference nila. Okay, so sources for vitamin D, we have fortified milk and margarine, fish oils, sardines, and salmon. And then, deficiencies of vitamin D would be growth retardation, okay, kidney damage or deposits in soft tissues, that is for elevated amounts, and then it becomes toxic beyond 2,000 international units per day. Okay, so just to give you a picture of yung osteomalacia versus rickets, may picture ako doon sa minerals na part. Okay. But then I can show you right now. Oops, sorry. Si Uncle Google muna. So this was the part na hindi ko nalagyan ng picture. The rest kay may picture. Rickets versus osteomalacia. Imagine nyo yung patient na may curving of the legs. Okay, so again, for rickets, that's for children. Okay, yung may pagka-bow-legged sila. Yan. Okay, so this is your example of a child with rickets. Okay, so by nature or ideally, dapat straight yung ating legs, di ba? But then for patients with rickets, especially young children, meron silang curving, yung curving of the legs. Okay, and we all know that growth and development wise, the younger years are important kasi that's the time wherein their bodies are still developing, especially their musculoskeletal system. So any deficiencies, especially with regards to vitamin D, this would lead to malformation. And that is why we have rickets. Okay, so ito yung rickets. Yung osteomalacia naman, okay, so that's for adults. Okay. Yung osteomalacia, okay. Ayan, ito yung osteomalacia in adults. And it is mostly characterized by pain, muscle and joint pain. Isa ito siya. Yan. Tapos may pagka-curving inward yung arms ng patient. Okay, so here, muscle pain, painful bones and joints. They will also experience difficulty walking. Okay, so it's quite painful. Okay? So yan. Ito yung part na hindi ko nalagyan ng picture. Okay? But the rest meron picture. Okay, so now you know. Okay? So if you want to remember osteomalacia better, ito yung mnemonics na ginamit ko nung student pa ako, yung osteomalascia. Okay, so may bones nga siya, kaso it's very painful, malas na. Okay, so ng literal definition ng definition or expression ng how the patient would be feeling with that kind of disease or disorder. Okay? Okay, next we have vitamin E. Okay, so vitamin E acts as an antioxidant. Okay, so description-wise, it exerts an especially important antioxidant effect in the lungs. Okay, so where the cells are exposed to high concentrations of oxygen. Vitamin E also protects the lungs from air pollutants that are strong oxidants. Okay, so it prevents the breakdown of vitamin A and K and unsaturated fats. It protects other substances from oxidation, and it protects the lungs from air pollutants. Now, next we have hemolysis of yan, ito na. Okay. So deficiency symptoms are hemolysis or destruction of your red blood cells and nerve destruction. So food sources ng ating vitamin E, we have vegetable oils, some green, some fruits, okay, wheat germs, peanuts, and oils. And then deficiency signs and symptoms, you have muscle weakness, headaches, fatigue, blood clots, and it becomes toxic beyond 1,200 international units per day. Okay, that's for your vitamin E. Next, vitamin K. Okay, so babalik at babalik kayo sa vitamin K, especially for your MCN or for your delivery room nursing. Okay, so ito siya. This is very important in your newborn care. Why? Because it helps in blood clotting. Okay, so function-wise, it helps in prothrombin and other factors for blood clotting and bone formation. So you may be wondering, bakit may vitamin K sa newborn care? Okay, so that is actually part of um, your essential newborn care. Kasi yung newborns natin, okay, wala pa silang own storage or wala silang own supply of vitamin K, okay, when they are born. So that is why we give them um, an injection of vitamin K for them to activate their blood clotting. Okay, so that is to prevent bleeding in your newborn. Okay, so a severe deficiency would result in hemorrhage or bleeding. Okay, so other sources of your vitamin K are the following. Okay, so we have green vegetables, non-fat milk, Okay, liver, broccoli, and eggs. And signs and symptoms, definitely, since if there is a presence of bleeding, the patient would exhibit anemia and jaundice, yung magiging yellow siya. Okay? So that's for your vitamin K. Okay, next we have your water-soluble vitamins. Okay, so we start with vitamin C or anti-scurvy vitamin functions. Okay, so the purpose or roles of vitamin C are the following. Okay, so they convert folic acid to its active form. They also heal wounds and bone fractures. They also help in the prevention of megaloblastic anemia and pinpoint hemorrhages, and they also assist in the building of body resistance against infection. Okay, so key disorder here, so it's mentioned here, megaloblastic anemia. Okay, so from the description itself, it's a whole destructive package, meaning yung mga healthy blood cells are all destroyed. Okay, so this includes the red cells, white cells, and platelets. So you would expect that your patient will be anemic at the same time, very prone siya to infection and also magiging prone siya to bleeding. So it's a whole destructive package when you talk about megaloblastic anemia. Okay? So yan yung major function ng ating vitamin C. Now, usually, no, if you would encounter patients who are coming from surgery, okay, so they would often have vitamin C supplements. Okay, so uh, back during my hospital experience, so every now and then, meron kaming mga patients coming from surgery, especially kung galing CS or cesarean section. Okay, so kahit yung mga yung mga patients who gave birth naturally, yung mga NSVD, yung normal spontaneous vaginal delivery, part talaga sa kanilang vitamin supplementation ang vitamin C. Why? Because it helps in healing of wounds. Bakit? Anong meron sa normal spontaneous um, delivery? It's because some patients have to undergo episiotomy. Okay, when we say episiotomy, meaning yung obstetrician maggagawa siya ng incision doon sa perineal area para para maglabas yung head ng baby. Okay, especially if medyo naiipit yung baby doon sa birth canal, okay, and then the head needs a wider opening. Kaya gumagawa sila ng incision. Okay, so again, your vitamin C will help in tissue repair, wound healing, and fighting infection. Okay, so hindi talaga mawawala si vitamin C sa ating nursing lives. Even we nurses, no, for our own protection, it is highly recommended na mag vitamin C junta before and after duty. Kaya at least kanang uh, one capsule a day. Okay? Especially before we go on our clinical duties. Okay. So other functions of your vitamin C, okay, production of steroid hormones, especially adrenocortical hormones under severe stress and insulin synthesis. It also aids in tyrosine and phenylalanine synthesis. Okay, so when we talk about phenylalanine, okay, so kindly take note of this one here, naka-highlight. It is an essential amino acid, meaning that it cannot be made in the body and must be ingested in the diet. Okay, so tyrosine is a non-essential amino acid and can be formed by hydroxylation of phenylalanine in the liver when the intake in the tyrosine is low. Okay? Next, iron utilization is improved by vitamin C, making iron more available for hemoglobin formation and red blood cell maturation. So, this is common in patients who are experiencing anemia. Okay? So, usually, meron talaga silang partner na vitamin C supplement while they are receiving iron. Okay, kasi mas nakaka-absorb ng iron yung bodies natin in the presence of vitamin C. Okay, so they can say that vitamin C is parang nag-assist siya sa pag-absorb kay iron. Okay? Okay, pwede sila use simultaneously because of its beneficial effect. Okay? Okay, next. Okay, vitamin C is involved in brain metabolism, okay, or in brain activity, brain health. Okay, it also has an antioxidant vitamin, protects normal cells from damage of free radicals. Okay, and it is also shown to help prevent cataract. So when you say cataract, this is a visual disturbance wherein there is a clouding in the eye of the patient. Okay, so beneficial siya when it comes to eye health. Okay. So next we have utilization. So almost completely absorbed in the small intestine, except in cases of achlorhydria and gastrointestinal disorders. Okay, so itong si achlorhydria, this refers to the absence of hydrochloric acid in the gastric secretions. Okay, so if you if you think about it, no, pag wala tayong hydrochloric acid sa ating gastric secretions, meaning hindi natin madadigest yung food na pumapasok sa stomach natin. Okay, so yun yung purpose ng ating um, kanang stomach acids. Okay? Next, we have adrenal glands. Liver and other glandular organs contain the highest amount of vitamin C in the body. Now, almost all plants and animals can synthesize vitamin C except for humans and other specific animals. So, as to the specific animals, I'm just going to do some research on this one. Okay? So, kung ano yung specific animals ang gina-indicate or gina-refer dito. Okay? So next, malnutrition. So a patient with early deficiencies in vitamin C would exhibit the following: okay, irritability, weakness, okay, lack of appetite, pallor, and lowered resistance to infection. So you would notice a person na repeated yung kanyang cough and colds. And another thing kanang sige gud naga-experience og luwas or yung mga mouth sores. Okay? So that could also indicate a deficiency in vitamin C. Okay? So be mindful no if may mga kasama kayo sa bahay or may kakilala kayo na always siya ubo sipon, meaning meron siyang it could indicate a deficiency in vitamin C. Okay? So next we have scurvy. Okay, so itong si scurvy, this is a severe type of vitamin C deficiency. So what would you expect in a patient with scurvy? Okay, so number one, meron silang bleeding. Okay, they have swollen tender joints. Okay, and because of this, they would experience pain. Okay, anything that affects the health of joints will also lead to pain. Next, the patient would also exhibit loose teeth, swollen gums, and capillary fragility. So, itong si capillary fragility, meaning mas nagiging prone din sila to, all the more magiging prone sila to bleeding. Okay? So, in infants, we have something called infantile scurvy. So, ito yung picture niya. So, the infant flexes his legs for comfort or the so-called frog's position. Okay? Because the thighs are swollen and the joints are painful. So, skeletal growth and dentition are affected here in your infantile scurvy or delayed yung kanilang skeletal growth and dentition. Okay? Another word or another term for this one is Barlow's disease, usually named after the physician or scientist who discovered the condition. Okay, so, ito yung picture ha na patient with infantile scurvy. Now, next we proceed to the food sources. So, food sources. So, it's not just citrus foods. It's not just citrus foods that contain vitamin C. We also have malunggay. Okay, so malunggay contains 231 milligrams of vitamin C. Next, we have kasui, okay, 167 milligrams. We also have bayabas. Okay, may bayabas na pula and may bayabas na puti. Okay? And then we have oranges and strawberries as food sources. Okay? Okay, so next we have water-soluble vitamins. So they help the body to burn the fuel, but do not serve as fuel. Okay, so we have 8B vitamins, which are part of the enzyme helper known as coenzymes. So coenzymes are small molecules that combines with an enzyme to make it active and attractive to substance. Okay, so na here, when it comes to our vitamin B, amazing siya. Ang dami niyang forms, ang dami niyang um, alternate na forms. Okay, so we know them as vitamin B1, B2, B3, okay, pantothenic acid, biotin. Okay, so they participate in the release of energy from carbohydrates, proteins, and fats. Okay, so for you to know this in more detail, okay, so please take note okay, yung of the different B vitamins. Okay, usually, no, if yung mga commercially prepared na vitamin B substances, we also know them as vitamin B complex. Okay, so vitamin B1 is known as your thiamine. Okay, please kindly list down. B2 is riboflavin or riboflavin. Vitamin B3 is your niacin. The pantothenic acid is your B5. The pyridoxine is B6. Biotin is B7. Okay, and then folate or folic acid, siya yung vitamin B9. And last, cyanocobalamin, vitamin B12. Okay, so as you can see, walang B4. Okay, so parang nag-skip sila. Okay. So far, no, in my study with nutrition, kahit nung student ako, ito lang yung mga particular numbers. Yung B1, 2, 3, 5, 6, 7, 9, and 12. Okay? I think it has something to do with the chemical composition. Okay? With regards to the numbers. Okay? Okay, so another detail that you should know, all B vitamins help the body convert food into fuel, okay, which the body uses to produce energy. Okay, so these B vitamins, often referred to as B complex, also help the body use fats and protein. Okay, so another observation that I noticed, no, yung sa mga patients ko before na who are admitted due to excessive vomiting or meron silang um, disorder na nakaka-cause ng malnutrition, very, very often, meron talaga silang vitamin B supplementation. Okay? So you would expect patients with malnutrition, okay, to have to be ordered with vitamin B complex as one of their vitamin supplements. Yan. Okay, so coenzymes containing B6 help enzymes to metabolize amino acids. Then coenzymes containing folate, they help making new cells but also depends on the coenzyme containing B12. Okay, so another thing, okay, so please take note, your vitamin B complex also helps in nerve and brain health. Okay. Usually din, no, yung another observation, may mga patients kami before sa internal med na with stroke. Okay, so some na they suffer from stroke and other neurological disorders. Meron talaga silang vitamin B to help promote brain and nerve health. Okay? So okay. So next, we have these two major vitamin D deficiencies. Okay, so these are berry. So this resulted when bran in rice is removed to make, whiter rice. Okay, so this is more on the food side. Okay, so the description for this is in another slide. Okay, we also have pellagra. Okay, so this results from a low protein diet and more in corn, which is low in tryptophan. Okay, kulang siya. Okay, tryptophan. Okay, so again, just the descriptions are more on the food side. Okay, so pellagra is a disease caused by lack of vitamin B3. So symptoms include inflamed skin, diarrhea, dementia, and sores in the mouth. So I'll show you pictures of the, sorry, I'll show you pictures of the disease of these two conditions in a while. Now, for those who are not familiar with tryptophan, okay, so tryptophan is an essential amino acid that serves several important purposes like nitrogen balance in adults and growth in infants. Okay, so it also creates niacin, which is essential in creating the neurotransmitter serotonin. Okay, so in a way, it also has a relaxant effect. Itong si tryptophan. Okay? Okay, so this is your patient with beriberi. Okay, itong si, beriberi, it could be either wet or dry. Okay, so let me zoom in on this one para mas appreciate niyo. Yung dry beriberi, okay, so these are the characteristics. So there is peripheral neuropathy. So meron siyang problems with um, nerve health. Sometimes, no, kanang they would have this feeling known as yung pins and needles na feeling on their skin. Okay, so that is an indication of poor nerve health. Okay. Next, there is muscle weakness. There's also gait ataxia or may disturbance sila when it comes to walking. Hindi nila mabalance yung sarili nila while they are walking. Okay, so you've encountered this in your health assessment. Okay, so itong si gait again, this refers to how the patient moves or how the patient walks. Okay, so unsteady gait. So they have hindi they are unable to keep their balance when walking because of their muscle weakness. Okay? Next, we have paresthesias. Okay? Yung what I can remember is that may tremors sila. Okay? If I remember well. Itong mga paresthesias, we can have. Yan. Yung abnormal sensation. Okay, so na-mention ko ito, yung usually it goes hand in hand with peripheral neuropathy, yung pins and needles na feeling, yung parang feeling mo may tumutusok sa skin nyo. Okay, so that is what you call your paresthesias. Next, we have Wernicke's encephalopathy. Okay, so ito si Wernicke's encephalopathy, it is a condition wherein there is a reduction in brain function. Usually, they appear and act drowsy, okay, very delayed yung mga responses nila. Okay, so most of the time, they appear sleepy, they are quite weak, fatigued, okay, as you can see in the picture. So that's for your dry berry. Now for your wet, yung pinaka-key feature nito is they have edema. Picture ito. So hindi ko siya ma-highlight. Okay, so just take note of basta wet berry, imagine increased amounts of fluid. Okay, so that is your edema. Okay, especially in the lower extremities. Okay, so high output heart failure is another sign and symptom associated with this. Okay, so you would also notice that a patient with wet beriberi has heart hypertrophy, especially of the right ventricle. Okay, so a patient with wet beriberi could either have tachycardia or bradycardia, but practice-wise, no, mas mauuna si tachycardia and then mag-follow si bradycardia. Why? Because in the presence of extreme or increase amounts of fluid within the body, your vessels, okay, your vessels or rather your cardiovascular system will try to compensate with those large volumes. So, mas magiging mabilis yung heart rate, okay, to distribute the excess volume across the body. Okay, but then later on, especially pag pag napapagod or na nagwi-weaken yung cardiovascular system ng patient, it would then lead to bradycardia. Okay? So, it's also the same understanding or same mechanism when you are dealing with a patient who is bleeding. Okay? So, mag-start sila with tachycardia. Why? Because it's the body's way of trying to go on defense mode or try to get into self-preservation mode. But then, pag hindi na-manage properly yung bleeding, yung tachycardia will then be converted or will then go down to bradycardia kasi naghihina na yung cardiovascular system ni patient. Okay? So next, you also have dyspnea or respiratory distress. Why? Because there are excess fluids going to the lungs, okay, because of this condition. Okay? So, meron talaga silang difficulty and even painful breathing. Okay? So, they are congested. Okay? Another term for this one is congested. Okay? So, because of the excess fluids in their bodies. Okay? And then, although meron silang edema, at the same time, they also have oliguria. Okay, poor yung kanilang urine output. Okay, and lastly, lactic acidosis. Okay, so mas nagiging acidic yung bodies nila in wet beriberi. Okay, next we have, ayan, ito siya. Ito yung sa pellagra. Okay. Pellagra, okay, so there are neurological impairments. Okay, so the patient would exhibit yung delusions or hallucinations. Okay, so another term for this one, yung nawawala sila sa sarili nila. Okay, so meron silang alteration in consciousness or alteration in brain function. Next, they have skin inflammation or dermatitis. So meron silang rash formation. They also experience nausea. Okay, so the feeling of vomiting. Yung hindi pa siya nag-actual vomiting but yung may feeling siya na gusto niya mag-vomit. Okay? Next, decreased appetite and watery diarrhea. Okay, so those are your main features for pellagra. Okay? So on the other side, this is how your patient with pellagra looks like. Okay? Sometimes yung rashes will also appear on the face of your patient. Okay? So ganito yung itsura nila. Okay? So here we have processes that protect people from deficiencies of vitamins. Okay? So we have fortification. So I mentioned this one during the early part of our lesson in nutrition. So this refers to the addition of food to food of nutrients that were either not originally present or lost during the process. Okay, so examples of these, no, yung mga no, sometimes we have junk food, no, or other food products na may makikita tayo sa label na fortified with vitamin A, fortified with vitamin C. And then you would easily identify this pag may sangkap Pinoy seal siya. Okay, so meaning nag-undergo ng fortification yung food item na yun. And then we also have enrichment. So the addition to a food of nutrients to meet a specified standard. Okay, so nandun na sa food yung nutrient na yan. Okay, so by by food processing, they simply add more of that nutrient to that food. Okay? So next, Okay, so we proceed with the other B vitamin. So B1 or thiamine, it helps in normal functioning of the nerve cells. So here, okay, we have the Wernicke-Korsakoff syndrome. This is a deficiency of thiamine due to alcohol abuse. Okay, so di ba, when it comes to people who engage in excessive alcohol consumption, nakakadamage siya ng brain. Okay, so alcohol impairs absorption of thiamine from the digestive tract and hastens its excretion in the urine. Okay, so pansin niyo pag you are into alcohol in that when you're into consuming large amounts of alcohol, 'di ba ihi kayo ng ihi. Okay, but then the downside of that one is that you lose your supply of thiamine. And because of this, okay, you have the following symptoms. So ito yung Wernicke-Korsakoff syndrome. Okay, so mainly yung ina-attack dito yung brain function ni patient. Okay, so for your Wernicke's, okay, so you have to remember code. Okay, so your code stands for confusion, ophthalmoplegia, or visual disturbances. Okay, so di ba kanang when you are heavily intoxicated, no, so sometimes, especially in the dark, no, sometimes you end up seeing things or na-alter yung perception niyo of the yung physical appearance of some people or of some things. Okay, so visual disturbances. Yung attack siya, again, yung unsteady gait, ito siya. Okay, so imbalances or problems with walking. And again, thiamine deficiency. Now, for the Korsakoff side, okay, so uh, we have the mnemonics rack. Okay, so retrograde amnesia, okay, anterograde amnesia. Okay, so you will encounter this when you have your neuro, when you have your neuro concept. Okay, so this refers to disturbances in memory. Okay, so affected dito yung mga long term and short term na memory. Okay? Yung confabulation, if I remember well, this is yung altered verbalizations. Okay, wait, let me check first. Okay, so if you look in the dictionary, okay, so usually kanang medyo sila kanang they tend to be quite wordy kanang in that yung if you happen to be a shy person tapos you get heavily intoxicated with alcohol, parang parang may switch sa brains niyo na grabe kayo mag makeup stories or grabe kayo mag overshare while you are drunk, so imagine a patient na kanang um, under the influence of alcohol, tapos sige siya tabi, sige siya naga storytelling. Okay, and the storytelling usually doesn't make sense. So that's what you mean by confabulation. Okay, yung quality ng kanyang language or quality ng kanyang thought, okay, na-alter because of the presence of alcohol. Okay? And next, you have your B3 or your niacin. Okay, so this can be made from protein. An amino acid tryptophan can be converted to niacin in the body. Okay, so 60 milligrams of tryptophan is equal to 1 milligram of niacin. So deficiency will result to dilation of the capillaries of the skin with perceptive tingling that if intense can be painful. Okay, so again, your B3 na it influences nerve health. Okay, so whenever you would feel that you have um, sharp pain or tingling under your skin, again, that's an indication na kulang kayo ng B vitamins. Okay? This can also be a pharmacologic agent in the form of drug as nicotinic acid that is effective in lowering blood cholesterol in the treatment of atherosclerosis. Okay, so that's for your B3. Next, pantothenic acid. Again, this is your B12. This is involved in more than 100 steps in the synthesis of lipids. This is more on the biochemical side. Okay, so you just have to be familiarized with the functions. Okay, sorry. It helps in the communication molecule of the brain. Again, it helps in brain and nerve health. It also helps in synthesis of lipids. It is essential for carbohydrate, protein, and fat metabolism, and also for normal growth. Okay, so healthy skin and integrity of the central nervous system. Okay, so again, when it comes to your B vitamins, they are major players in brain and nerve health. Okay. Next, we go to biotin. Okay, so this plays an important role in metabolism as a coenzyme that carries your carbon dioxide. Avidin is a protein in raw egg white that contains a harmful substance. So biotin binds avidin and it renders it harmless. Okay? It helps in the synthesis of purines and folic acid. Okay? Itong si biotin. But personally, least known itong si not least known itong si biotin compared to the other B vitamins. Next, you have your, wait, sorry ha, yung pantothenic acid, I think I made a mistake. Yung pantothenic acid, yan ha. Let me check if tama yung pagsabi ko na B12 siya. Ito, B5 pala ito. Sorry guys. Okay, kasi yung nasa mind ko is yung B12. Okay. B5 ito. Sorry. Okay. Next, you have your B6 or pyridoxine. So this is stored extremely or exclusively in muscle tissue. It aids in the conversion of amino acid tryptophan to niacin. It is an anti-convulsant vitamin. So usually, yung mga patients who are suffering from seizures, meron silang supply of pyridoxine, a vitamin B6 na supplement. This prevents nausea and vomiting in pregnancy. It catalyzes urea formation and the synthesis of EFA. Yung si essential fatty acids natin. Okay? So that's for your B6. Okay, next we have folate. Okay, so folate or yung folic acid natin, this is important in the synthesis of heme. It helps in the treatment of sprue. So itong si sprue, it is a malabsorption disease. Okay, so this is essential in erythropoiesis. So when we talk about erythropoiesis, meaning yung formation ng red blood cells natin. Okay? Deficiency will result to anemia and gastrointestinal tract deterioration. So antagonists of your folate are alcohol, aspirin, contraceptives, smoking, and anticonvulsant. Okay, prevents NTD. NTD natin stands for neural tube defect. Okay? This is also one of the common vitamin supplements that pregnant women receive. Okay? So it prevents neural tube defects such as spina bifida. Okay, itong si spina bifida, okay, so we are just mention about this condition. You will encounter this in delivery room nursing and even in pediatric nursing. Okay, so itong si spina bifida, it is a malformation, okay, doon sa spine ng baby. Okay, so this usually happens in a mother who had a deficient amount of folic acid during the time na nag-carry siya ng pagbuntis niya. And then when the baby comes out, meron outpouching sa kanyang spine banda. Okay, so naging exposed yung portion ng spinal column. And because of this, the baby may experience difficulty walking, difficulty in maintaining motor function. Okay, so that's what you call your spina bifida. Yung spina bifida, okay, so Uncle Google sa ta. Ito siya. This is how your spina bifida looks like. Yan, ito siya. Yan. So, may portion ng kanyang spinal cord na exposed, okay, because of lack of folic acid during those crucial periods. During the time na nag-undergo siya ng development while in the womb of the mother. Okay? Ito siya. That's your spina bifida. Okay, and last few slides for your vitamins. Okay, ito siya, vitamin B12. Okay, so cyanocobalamin or your B12, this needs an intrinsic factor for absorption from the intestinal tract to the bloodstream. So itong si intrinsic factor, it is a mucoprotein enzyme secreted in the fundus where it attaches to the vitamin. So in the event or if the patient is suffering from sprue, nawawalan siya ng supply ng kanyang intrinsic factor. Okay, so tissues in the body that contain the highest concentration of B12 are kidneys, testes, brain, spleen, pancreas, and bone marrow and muscles. Okay, so intrinsic factor, yung other functions niya, lang. Okay, so for you to understand the role of intrinsic factor more, it helps in the absorption of your B12. Okay, siya yung key para ma-absorb si vitamin B12. Okay, so next, okay, we proceed with choline. Okay, so it mobilizes fats and prevents fatty liver. It's needed for fat transport as a constituent of phospholipids. And it is an integral component of acetylcholine that helps in the transmission of nerve impulses. Again, it's very much involved in maintaining nerve health. Okay, so deficiency of this one may result to fatty liver. Now, if you want to add more choline to the diet of your patient, so highest food sources are egg yolk, liver, brain, kidneys, heart, and legumes. Okay? I think with the brain, usually, yung sa brain sa manok, yung medyo mushy na, part, mushy parts ng, brain, ng chicken. Okay? Sa mga organ meats, basically. Okay? Organ meats. Next, you have taurine. So this is added to milk formula to provide concentration similar to breast milk. Okay, and it's a component of bile acid. It regulates heartbeat and it's important for retinal development and function. So retinal development, it's more on eye health. Ito siya. Now, best food sources are fish oils and meat. And then last few slides, okay, I won't go over this. You can um, refer to this on your own, when you study the slides. Okay, so we have here is an overview of the water-soluble vitamins and with their functions, deficiency, toxicity, and food sources. So kindly familiarize yourselves um, with this table. Kasi when the time comes that you will have your clinical duties and then you will handle patients with vitamin B deficiencies, at least meron kayong ma-healthy source ng health teaching. Okay? So that's it for your vitamins. Okay, for those students in 2E na set na kayo for your uh, clinic appointment, you may go. Anyway, i-record ko naman ito siya. So, I'll just continue with the rest of the discussion with 2G. And for those in 2E na wala pa yung nila, yung clinic appointment. Okay, just stay as long, stay on longer as long as possible, okay, para maano ninyo yung lesson. But then again, anyway, i-record ko ito siya. Naka-record naman ito. Okay? So next we proceed to micronutrients. Okay, so it's more on visuals. Okay, just short discussion of this will do. Okay? Sige. Okay, can you see my slides clearly? Okay. So for those who are still in the session, this is our next lesson. Okay, so shorter ni siya, makaya ni siya by matapos ko siya by 9:30. Anyway, it's more on pictures in most of the slides. Okay, so when we talk about minerals, they are simple inorganic elements that are non-caloric and remains ash when the food or organic compounds are found is completely burnt. Okay, so more on the biochem side ito siya again. So they function as structural component of molecules in the cells, regulating normal physiologic process of the body, such as acid-base balance, metabolism, muscle contraction, and control of nerve impulses. So even though they come in small amounts, they still help in the basic function and health of our bodies. Okay? So just like our vitamins, they are classified according to their amount. Okay, so we have macro minerals and micro minerals. Okay, so next, okay, so let's go to macro minerals first. So the macro minerals are greater than 0.005% of body weight. And the minerals under macro, okay, we have calcium, phosphorus, potassium, sulfur, sodium, chlorine, and magnesium. So kindly familiarize yourselves with these macro minerals. So just to add additional information, in the hospital or in the clinical setting, you would know the amounts of these minerals based on blood chemistry. Okay, blood chemistry. Okay, so it is a blood test that will give you a picture of give you a detailed picture, or it will give you the specific amounts of the macro minerals or electrolytes present in the body of your patient. Okay, so blood chemistry. Okay, so each of them, they have their own normal values or normal range. So I think nandun siya sa meron kayong table nito sa fundamentals in nursing na manual. Okay? But definitely just you have to be familiarized with the function of each one. Okay, function, description of each one, and food sources as well. Now, for calcium, it's 99% in bones and teeth, and it's an integral part of bone structure. Okay, so functions, it aids in bone and teeth formation. It also transmits nerve transmission. It's also involved in muscular contraction and lastly, blood coagulation. Okay. So food sources of calcium, we have the following. So puhol, dilis, okay, cheese, shrimp, seaweeds, malunggay, yung jute leaves or your saluyot, crabs or your talangka, and then milk and sardines. Okay, so it's not just milk that's the only source of calcium. You have other sources of calcium. Okay? Now, for deficiency, again, nandito na naman itong C. rickets. So, softening of the bones that may easily break. So, this is in children. Okay, so, here's another picture. Okay, so, the main characteristic or the main feature of your rickets is faulty process of bone mineralization. So, there is deficient or impaired metabolism of vitamin D, phosphate, and calcium. Okay, so again, for your rickets, it's found in children. Pag osteomalacia, it is in adults. But the features are mainly the same. Nagdi-differ lang sila sa affected age group ng patient. Okay? Again, here's a picture of your patient, of a pediatric patient with rickets. So definitely they experience stunted growth. They have unusual posture or specifically odd curve to the spine or back. They have large foreheads. Their ribs and breastbones are also malformed. And they have large abdomen, wide joints at below the waist, odd-shaped legs, wide ankles, and wide bones. So, affected yung kanilang movement, okay? Proper gait or proper walking. Okay, next we have phosphorus. So 1% of total fat-free body weight. It's found in 85% in bones and teeth with calcium. Okay, so magka-partner na sila ni calcium. Okay, so phosphorylation of glucose, important in transport system of glucose in the cells. Okay, so it's involved in the energy transport, okay, in the cells. Okay? So, although this is more on the biochem side, ito siya. Okay? Okay, so phosphorus is a constituent of the active form of thiamine as thiamine pyrophosphate, which is an important part of the RNA and DNA molecules. Okay, so yung important lang guys, again, this is uh, involved siya sa bone formation together with calcium. Okay? Now, for our deficiency, we have hypophosphatemia. Okay? This can cause skeletal myopathy and cardiomyopathy. Okay? So, altered yung function ng ating skeletal system and even our heart muscles. Okay? So, if kulang tayo ng phosphate, usually affected yung, sorry. Usually affected yung heart muscle activity ni patient. Okay? So, you would expect na may bradycardia yung patient or may abnormal heart reading siya sa electrocardiogram. Okay? Now, in toxic amounts or in elevated amounts, this is known as hyperphosphatemia or increased amounts of phosphate in your body. So this can cause erosion of the bones. Okay, so generally, anything in excess or a lack of it can can lead to um, damage in our bodies. Okay, so next we proceed to potassium. Okay, so just remember the key details that I'm saying. Okay, next we have potassium or kalium. Okay, so if you remember your periodic table, okay, so perhaps no, kind of chemistry was one of your, I think chemistry was one of your terror subjects back in high school. Okay, so if you remember your periodic table, nandun actually si potassium. Kaso, yung ano niya is K. Okay, so K ang makikita ninyo. Okay? So, it is a principal ion present within cells or in the intracellular fluid. So, if the level in the blood increases to a very high level, muscular coordination is disturbed and cardiac arrest occurs. So, ano siya ka na? Additional fact, um, potassium, okay, specifically in potassium chloride, it is one of the medications used in lethal injections. Why? Because large amounts of potassium can lead to stopping of heart activity. Madededs yung heart natin in the presence of excess potassium in our bodies. Okay, so another important thing about calcium, in its pure form, naka-vial siya. Okay, so if we encounter a patient who is in need of potassium supplementation through intravenous fluid, never ever give it as a bolus. Okay, so all caps na nako ni siya. Okay, if there's one thing that I would want you to remember about potassium is never give as bolus. Okay, it is diluted. It is diluted. Okay? So, usually, ginahalo yun siya sa plain NSS or your normal saline solution. Okay? To reduce its toxic effects. Okay? In plain NSS. And, okay? Because basically it is involved in heart function. Okay, so any excess or even a lack of potassium can give consequences to our heart function. Okay, so ma-alter yung ating normal functioning ng heart ng heart natin. Okay? So yung pinaka worst na effect, as I've said, no, especially pag lethal injection or if a patient has toxic amounts or elevated amounts of potassium, nakakakos siya ng heart attack or cardiac arrest. Okay? Uh, okay, so we proceed to our deficiency. So it's known as hypokalemia. Okay, low serum concentration of potassium. So this results when there is malnutrition and prolonged gastrointestinal loss of potassium as in vomiting, diarrhea, and diabetic acidosis. Okay, so usually no, yung back when I was in the hospital, we would have patients who were admitted due to increased vomiting. So in pregnant patients, we know this as hyperemesis gravidarum. Okay, so in the normal course of pregnancy, uh, the pregnant woman is expected to vomit. Okay, so morning sickness. So that is in the first trimester. However, if the vomiting goes beyond the first trimester and the vomiting is uh, tapos if the vomiting is uncontrollable, okay, that's a time na maano siya as hyperemesis gravidarum. And yung pinaka worst effect niya is yung hypokalemia kasi nawawalan siya ng potassium because of the repeated vomiting. So whenever we would have a patient with hyperemesis gravidarum, meron talaga silang potassium supplementation via intravenous fluid. Okay, so we call that yung potassium drip. Okay, potassium drip yun siya, and the number of cycles will depend on the severity of the patient's hypokalemia. Okay, so some doctors would order 1 cycle or 2 or 3 cycles, and then sometimes in between cycles they would order for serum potassium in the blood chemistry. Why? Because they want to make sure na the potassium levels in the patient's body is within therapeutic range. Okay? So, siya ka ng yung mga potassium drip, that was one of the common um, IV, IV administrations that I did back when I was working. Okay, so siya kanang very maputi kami when it comes to potassium drip. Again, when it comes to potassium drip, no, kanang dapat siya, hindi siya pwede i-fast drip kasi it has to be regulated. Again, because elevated amounts of this one, or if given in large amounts in a short span of time, nakaka-affect siya ng heart. Okay, so that is why mag-instruct jud mi sa mga watcher na, ma'am, sir, ayaw jud pangilabot sa potassium ha. Okay, so may mga watchers talaga kasi sa SPMC noon na um, mangilabot jud sa dextrose or sa IV yung sa roller clamp good. Okay, so sometimes no, when I would make my rounds tapos alam ko na may potassium drip ang patient, pag check ko sa dextrose kay hala paspas lagi ang tuluan ni and the tuluan yung drops niya per minute, and then magsabi pa yung watcher tapos proud pag yun, ay ma'am akong gikusgan kay hinay man good. Diyos ko Lord kanang or mugawas siya na kung beast mode pag ana ang case, no. So um I would instruct the watcher na no jud manipulate sa IV line or sa dextrose ng patient kaya that's anong controlled medication si potassium. Okay, so na mga moments at work, no, nakaka-frustrate na at the same time nakaka-scary, no, especially when it comes to the well-being of your patient. Okay. So next, we have your toxicity. Okay. So toxicity of your potassium is hyperkalemia due to elevated serum potassium due to kidney disorder. Okay. So sources, no, of your food sources of your potassium, we have nuts, okay, meat, legumes, milk, raw fruit juices. And it's not just the banana. Okay, so most students now would always refer to banana as the one and only source of potassium. No, ang dami naman mga sources. Okay, and these are here. Okay, so green leafy vegetables, raw fruit juices, nuts. Okay, so these are other sources of your potassium, not just the legendary banana. Okay? And then just to additional information, no, lalo na pag nasa ward kayo and you are handling a patient with blood transfusion. So typically no kanang the doctor would ideally order blood chemistry after every blood transfusion. Why? Because after blood transfusion, mas nag-increase yung serum potassium levels in the patient. Kasi it has something to do with the increased release of potassium into the normal circulation because of blood transfusion. Okay, so back then may nabasa akong article about that one, yung relationship between blood transfusion and potassium. Okay, kasi I remember one case, no, may patient kami na injured to massive bleeding. Okay, tapos inorderan siya ng blood transfusion tapos ilang bags good yan. Okay, um I think dumaan siya ng six blood bags during her whole hospital stay, and then in the end namatay lang siya. Why? Kasi it was too late when the OB-GYN decided to check yung blood chem. Okay, so yung yung potassium level ng patient, yung late lang good nila na-discover, it was 10. Okay, so basically yung normal serum amounts of potassium, if I remember well, it's 3.5 to 5. But then, yung sa patient na yun, 10. So, imagine nyo lang ha, na times 2 of the normal therapeutic range. So, ideally, no, kanang every time na blood transfusion unta sila, gi-check talaga yung potassium levels through blood chemistry. Okay, so never ever underestimate the laboratory results of your patient, lalo na if meron silang monitoring for potassium and other important electrolytes. Okay, so sometimes, no, sa sobrang busy nila, they tend to overlook yung mga lab results. So, ang gawagod namin doon sa nurse station, um, we analyze, we monitor yung mga normal lab values. And then if may makita gud kaming anomalya or unusuality, we remind or we tell the doctors na kanang taas siya potassium, or kanang taas siya magnesium. Dili na nato ipadayon ang yang potassium or magnesium drip. Ganon good na instances na you're not just there to simply follow doctor's orders. We are there to analyze, no? Analyze. We are there to make decisions as well. Kasi we nurses, we also work independently. Okay, meron naman kasi tayong independent nursing actions, and having that wisdom, having that knowledge when it comes to doing your independent and collaborative nursing functions, it can save patients' lives, no? So, be mindful talaga na of those lab values. Okay, so you will appreciate that more when you have your pre-clean. So let's say for example, no, if you have the chance to browse through your patient's chart tapos magdaan kayo sa my labs. Okay, so pwede kayo mag-analyze ng mga labs, no? Is to check for any unusual lab values, mga ganun. Okay? So just to give you a teaser or what to expect sa clinical duties ninyo. Okay, so do not underestimate your role as a nurse, no? Especially when it comes to lab values. Okay, next we proceed to sodium. Okay, so sodium is 50% of sodium is found in extracellular fluid, and 40% is found found in skeleton bound in the surface of bone crystal. So this allows passage of materials like glucose to the cell wall, and it maintains normal muscle irritability or excitability. And in addition, it's also involved in the normal fluid volume balance in the body. The thing kasi with your sodium is that where sodium goes, water follows. Okay, so in cases of patients with edema, yung meron silang alteration or meron silang issue sa sa sodium. Okay, so you'll see that in the next few slides, what I'm talking about. Okay, so yung deficiency in sodium, it's known as hyponatremia. Okay, so this occurs when dehydration, as in heat exhaustion, especially large intake of water without providing additional salt. So after procedures with marked loss of blood. Okay, so blood is considered kanang fluid, a vital fluid in our body. So in cases wherein your patient is experiencing heavy bleeding, nawawalan din siya ng sodium. Why? Because where fluid goes, sodium follows, and vice versa. Where sodium goes, water follows. Okay, so that is why pag in cases of severe blood loss, meron talaga silang plain NSS or yung normal saline solution. Okay, so they really have to hydrate the patient right after experiencing massive blood loss. Okay. Next for toxicity, hypernatremia. So if excessive edema will result in hypertension and kidney disorder. Sorry, na wrong spelling pag type. And kidney disorders. Okay? So that's for your that's for your toxicity, hypernatremia. Okay? So yung pinaka main feature ng patient with hypernatremia, usually may edema yun siya. Okay? So excessive yung volume na fluid volume niya within the body. Okay? This also indicates kanang kidney damage. Okay? So next, we have a diet protocol or diet management. Okay, so DASH. Okay, so dietary approach to stop hypertension. Okay, so this is to reduce the amount of sodium in the body. So you emphasize fruit, vegetables, low-fat dairy products, whole grains, poultry, and fish. Okay, to reduce the instances to help stop or reduce hypertension in the patient. And at the same time, kanang ma-balance yung excess amounts of sodium in the body. Okay? So sources for sodium, okay, we have animal meat, carrots, spinach, celery, and processed food like tocino, bacon, and ham. Okay, so they have large amounts of sodium, okay, for the added flavor as well. No, and also for preservation. Kasi yung mga meats din natin, no, they have sodium, okay, because to help preserve their integrity. Okay? Next, we have sulfur. Okay, so sulfur is concentrated in cytoplasm, but highest concentration is in the hair, skin, nails, and skin. Okay, so sulfur maintains protein structure, activates enzymes, participates in detoxification reaction with toxic materials, and convert these to non-toxic forms which are excreted in the urine. Okay, so itong si sulfur, okay. And not much description for this one, but to add, no, just for you to have an idea what sulfur is used for. Sulfur uses. Okay, sulfur uses for skin. Okay. Pansin good ninyo yung mga sulfur soap. Okay, so yung mga medicated soaps, they contain sulfur. Okay, so sulfur is needed for skin health. Okay? So, especially in treating yung mga common skin disorders, no, yung mga skin infections, okay, sulfur is the one to call. Okay, so, in fact, I remember, may kasama ko dati sa hospital, may kakilala siya na doktor, tapos sinabihan siya ng doktor, no, the best soap to use after duty is sulfur soap para ma-disinfect talaga yung whole body ninyo after coming from duty. Okay, because of its antibacterial properties. Okay, so that's for sulfur. Kasi imagine nyo lang ha, na nag-duty mo in the hospital and then you are exposed to different microorganisms, mga bacteria, no? So to be safe, especially upon returning home, pinaka-ideal soap to use is sulfur. Okay, ano man siya, mas isog siya compared to Safeguard. Basta may sulfur na component. Okay, so pwede si Dr. Wong or other brands of soap, basta may sulfur. Okay? Next, ihapit na tamahuman. Okay? Next, we have chlorine or chlorine. It's a major anion in extracellular fluid. It maintains acid-base balance. Okay, so your cerebrospinal fluid has the highest concentration of chlorine. Okay, so it contributes to necessary acidity needed in the stomach for activation of pepsinogen to pepsin for the breakdown of protein. Okay, so itong si pepsin, it is a stomach enzyme that helps serve to digest proteins found in ingested food. So ito yung uh, gina-power up ni chlorine. Okay? So sources for chlorine, we have table salt. So yun lang yung source niya. Next, we have magnesium. Okay, so it is a muscle relaxant. It helps muscles to relax after contraction with potassium and sodium. So deficiency, hypomagnesiemic tetany. This is observed among infants and children suffering from kwashiorkor. So if you remember, itong si kwashiorkor, it is a disorder, a nutritional disorder related to protein deficiency. Okay, so this is characterized by intestinal malabsorption, prolonged diarrhea, and vomiting. Okay? So, la, nawala lagi ang picture ko. Okay, so itong si hypomagnesiemic tetany, when I searched last night, okay, so usual, okay, so mas usually mas common ito siya sa mga cows. Yung it's a condition with cows na kanang they would have poor muscle function. Okay, so they would end up dying this way. Okay, so ganito yung itsura ng cow na may hypomagnesiemic tetany. Okay, so they end up having poor muscle function. Tapos ito siya, this is the one of two pictures showing yung baby with hypomagnesiemic tetany. Ay, sorry. Okay, basically siya it involves poor muscle function and coordination. Okay. Limited lang yung pictures ng hypomagnesiemic tetany. Okay? But you get the idea na it has something to do with muscle activity. Okay? So weakness, okay? Muscle weakness, okay? Makikita natin dito. Now, sources of magnesium, we have nuts, soybeans, meat, milk, cocoa, seafood, whole grains, dried beans, and peas. Okay? So, that's for your magnesium. Now, for the last few slides, okay, we have the microminerals. So, when we say microminerals, it is less than 0.005% of body weight. So, we have the lesser known or we have minerals that come in smaller amounts, such as your iron, zinc, selenium, manganese, copper, iodine, and fluorine. Okay, itong si fluorine, I think this proper spelling for this one is fluorine. Yeah. Okay, so we have iron. So it is the most abundant trace mineral in the body. Okay, so this is found in both plants and animals containing ferrous. Okay, ferrous ito siya. Only 10 to 15% of dietary iron is absorbed. So there is an increased need in ferrous during pregnancy for the growth and development in children. So for those na duty sa mga health centers, no, especially pag may patient kayo na buntis, iron is also one of the common vitamin supplements that they have. Okay? So basically, it also helps prevent anemia. Iron deficiency anemia. Okay, so deficiency, I just mentioned, it is your iron deficiency anemia. So characteristics of this condition, okay, are the following. Okay, so red blood cells are pale and small. They cannot carry enough oxygen from the lungs to the tissues. Okay, so energy metabolism in the cell falters. So that is why, basta you would encounter a patient with anemia, they often appear fatigue. Okay? They are fatigued, they exhibit pallor, okay? Very pale sila. Okay? And sometimes, no, especially if hindi maganda yung pag-manage sa anemia, they also experience difficulty in breathing. Why? Because kulang sila ng oxygen. And we know that our red blood cells, no, are essential in our hemoglobin and our red blood cells, they are essential in transporting oxygen to our different tissues within the body. But here in iron deficiency anemia, kulang na kulang tayo ng oxygen. Kasi hindi enough yung capacity ng ating blood to carry oxygen. Okay, from the lungs to the tissues. Okay? So next sources, okay, so we have meat, fish, and poultry, and dark green leafy vegetables. And also yung mga organ meats natin. Okay, so yung mga atay lovers here, di ba? That is one of the good sources of iron. Okay? Next, we have selenium. Okay, hapit na dito mahuman. Okay, so selenium is a part of a group of antioxidants enzymes. So glutathione peroxidases prevent free radical formation by blocking the damaging chain before it begins. Okay, so this is more on kanang cell protection. Okay, again, do not stress yourself out too much dun sa biochem na side. Okay, so we have to focus on the nursing side. Okay, para less stress. Okay, so this plays a role in converting thyroid hormone to its active form. It plays a role in preventing degenerative diseases, okay, such as neurologic disorders, cardiac disorders, and cancer. Okay? So your sources of selenium are the following. Okay, so organ and muscle meat, seafood, whole grain, cereals, dairy products, and garlic. Gutom na ko. Sige. So, okay, again, these are your sources of selenium. Next, you have iodine or iodine. So this is used for the synthesization of thyroxine, which controls basal metabolism. So a deficiency in this, okay, so we have goiter. So iodine in the blood is low, and cells of the thyroid gland enlarge in an attempt to trap the many particles of iodine as possible due to iodine iodine deficiency. So itong si goiter, yung pinaka-common picture nito is there is an enlargement in the thyroid gland of the patient. So ito yung itsura nila. Okay, may swelling sila doon sa may throat banda. Okay, so goiter. Ay, tama. Okay, hindi pala na-save yung paglagay ko ng images for this one. Okay, so here yung pinaka-mark na goiter, this one. Yan. Okay, again, enlargement of the thyroid gland. Okay, ito yung sa goiter. Ay, nandito pala sa kabilang slide yung picture. Sorry for that one. Okay, so goiter, okay, it's caused by goitrogen, anti-thyroid substance that enlarges the thyroid gland and causes toxic goiter. So sources of your iodine are seafood and seaweeds, and fortified and iodized salt. Okay, so here is another picture of your goiter. Okay, so this is your normal thyroid gland, but in the presence of goiter, mag-swell talaga siya. Okay, there is a visible swelling, okay, and large thyroid gland. So if you can remember, no, dun sa health assessment ninyo, there is a part wherein you are examining the throat of the patient. Okay, so ano yung position natin? Di ba tayo sa likod ng patient, and then we use our hands, okay, to feel around the patient's throat to identify for any enlargement of the thyroid gland. Okay? So last few slides. Okay, so again, still to continue with iodine. So another disorder associated with deficiency is cretinism. So severe thyroid hormone secretion during pregnancy causes extreme and irreversible mental and physical retardation. Okay, so as for the sources, iodine containing sea mist, iodized salt, and seaweed. So in your next slide, this is how your patient with cretinism looks like. Okay, so the hair is dry, coarse, and sparse. Lateral eyebrows are thin. There is also periorbital edema and puffy tingnan yung kanilang face. So dull face with dry skin. Now, for babies, no, as for their other physical characteristics, definitely, yung pinaka-main feature dito is yung stunted growth. Okay, and reduced growth and function of many organs. Okay, so that's for your cretinism. Okay, last two slides, you have your fluorine. Okay, so hydroxyapatite forms from calcium and potassium will be mineralized to fluorapatite. Okay, so this makes teeth more resistant to decay. Okay, so fluorine or your fluoride. Okay, so associated siya with dental health. Okay, so when fluorine is present in oral fluids such as saliva during mineralization process. Okay, so to differentiate between the two, fluorine stands for the element. And fluoride refers to the fluoride ion or compound that contains the element fluorine. Okay, so just for you to understand the main differences between the two. Okay? But the most important thing to remember is that associated itong si fluorine with dental health. Okay? So sources, okay, so fluoridation of water as recommended, fluoride toothpaste, and oral rinses. So, yung mga mouthwash na may fluorine content, okay, so those are your sources for your fluorine. Okay? And that ends our lesson.